Last night. She's from California, the senator telling Iowa voters she wants to put everyone on a Medicare for all plan, even if that means eliminating private insurance for about 150 million Americans. Watch it.
The idea is that everyone gets access to medical care, and you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork, all of the delay that may require. Who of us has not had that situation where you got to wait for approval and the doctor says, well, I don't know if your insurance company is going to cover this? Let's eliminate all of that. Let's move on.
Access to health care, but does that mean you actually get some? Republican Congressman Mark Green of Tennessee, also a physician. I want to tell everybody you ran a medical company in Tennessee for many years and served 2 decades as a special ops flight surgeon. So we appreciate you being on the program and with your expertise on this. My first question is, what does this do for the middle class? Because you have some strong ideas about that.
Sure, absolutely. All of the attacks on the insurance market with Obamacare and this plan do nothing but take away choice from basically from the middle class. I mean, it was a big cost shift to the small businesses. That's what Obamacare did. And Medicare for All will do nothing but, I mean, our costs. The Mercatus Center has said $32.6 trillion over 10 years for this plan. The 70% green plan that's being floated around there for taxes would only raise $700 billion over 10 years. $700 billion versus a cost of $32.6 trillion. I mean, my comment is earth to Senator Harris, that doesn't add up.
And you'd have to raise taxes to do that, right?
Even if we double taxes, on every individual in America, we can't reach the $32.6 trillion. It's insane. It's just crazy.
What I hear you saying, too, is that more people would have to, and I would imagine the wealthier among us would have to pay out of pocket, and that gives them the kind of advantage that, I don't know, tell me if I'm wrong, Congressman, widens the gap between the rich and the poor.
Absolutely. Those who can afford it will just create Cadillac healthcare systems for themselves, and the rest of us, I mean, nobody's emulating Canadian healthcare. I mean, I got a friend up there, 6 months to get an MRI. If we go to healthcare for all, that's what we're going to have. We're going to have rationed care, and it's not going to be what Americans want. And then, of course, those who can afford it will have what they need. And that is a huge divide between the haves and the have-not, only making it worse.
I want to get your response to Democrat Senator Blumenthal, who says he does not agree with eliminating all private health insurance. Let's watch.
I support a Medicare for all program, but not necessarily eliminating all private insurance. And I think there is room for private insurance, even providing the benefits and rights that people now enjoy under the Medicare system.
We saw on Twitter the president's reaction to Blumenthal today. We won't get into that for now. But, you know, there are some concerns. You are among just 17 by our count in our brain room physicians on the Hill who are serving us as lawmakers right now. How does that help the situation to have actual doctors working on this?
Well, having physicians there, we can see from one side of the stethoscope what patients are dealing with. I mean, they come into our offices and they talk to us about how they pay for their services that they're getting, and we of course negotiate with many of them. We give free care, so we're on the tip of the spear seeing what happens to those patients. So yes, I think our perspective is essential. And then you've got folks like myself that also went ahead and ran a healthcare company, and I actually have been a cancer patient myself, so I've been on the other side of the stethoscope. We cannot do away with the third-party payers, the insurance that's out there. It's a critical part of our health care system, and very short-sighted on the other side of the aisle.
Well, it represents at least 1/5 of our economy. Some people say it's higher than that. It would be a jolt to the system if we change it in any way, as we've seen in the past. God bless you in your own health journey as well. Good to see you. Thank you for joining me.
Thanks, Harris. Thanks for having me.